got baggy eyes suddenly. Which way to solve it? I have a very pronounced tear line and hollow eyes, and it never troubled me. A month ago, the eyelid and skin suddenly dropped, and loose skin is making the line of tear line worse. Plus, my eyes look less sharp. I've been suggested temporal fillers on the tear line to push it up, but I hate the idea that after 1 year it will be the same story again. I'd like fat transfer, but it seems that that area is the most difficult one. Thanks. Could an eye lift tighten the orbicular muscle or a procedure like canthopexy?
Thank you for your question. You've submitted a question with two photos, one with your eye at rest and one with activity. And you've described a situation where suddenly the skin has gotten baggy and that essentially what it appears to be a description of relative hollowing, and that you have had a consultation and it was recommended that you have a filler. And clearly you've done some research and you mentioned tightening of the orbicularis muscle and canthopexy. Well, as a cosmetic oculofacial plastic surgeon practicing for about 20 years, I can tell you that your confusion is certainly fairly common. And there are a lot of mixed messages when you are doing research to find out a solution for this exact type of situation. A few years ago, I wrote a book called The Fine Art of Looking Younger. And as someone who's also boarded in facial cosmetic surgery, I perform a lot of facelifts, cheek implants, and I recognized years ago how challenging it was to really help people understand the basic issues that we often refer to as facial aging, but it really is also about genetics. A lot of times these same symptoms that you have are things that happen for a lot of younger people as well. So genetics plays a very big role. Understanding the eye area is very, very sensitive to the effects of the environment and stress. And going back to the reference about the book I wrote, The Fine Art of Looking Younger, facial aging has to do with two basic issues. One is volume loss and the other is descent or sagging. Now typically volume loss is impacted on people somewhere in the ages of the 30s and 40s more than sagging, which tends to occur a little bit later. Now, understanding that volume loss doesn't only mean hollowing under the eye, and when you think of volume loss, think of bone, muscle, fat, skin, soft tissue. And so with all of these areas being affected, it is understandable that laxity can be interpreted as excess skin. So when you smile and you feel like there's a bunching of skin, or when you pull the skin up and you notice that it looks so much better, you're naturally tempted to do some type of surgical procedure. Well, when I evaluate a patient like yourself in my office, I do a few things to understand what the situation is. So first of all, we look at the anatomy and the structure of the lower eyelid. The lower eyelid is almost like a hammock in that it is connected to two parts of the bony orbit, or the bone around your eye. And sometimes there is an area of laxity, particularly in the outer aspect called the lateral canthal tendon, and we refer to it as lateral canthal tendon laxity. Now, if that's the case, then understanding a tightening procedure such as a canthoplasty, canthopexy, lateral tarsal strip, basically some kind of tightening procedure, orbicularis muscle strap. I mean, these are all techniques that very smart oculoplastic surgeons have developed and have been a great tool in my toolbox for years, is one part of the strategy. When we look at, it's like facial aging, we look at, for facelifting and volume loss, we combine lifting and filling. A similar type of strategy can be employed in the eyelid area. I'll share with you an approach that I typically do in my practice, and not saying that this is exactly what is right for you. But to address skin quality under the eyes, we use something called platelet-rich plasma. Platelet-rich plasma is your own blood that is centrifuged or spun, and the part of the blood called the serum and the platelets, or the plasma, is concentrated, and borrowing some of the knowledge that was achieved from orthopedic surgery, oral surgery, athletes are getting injections of platelet-rich plasma for joints for chronic injuries. We have found a tremendous benefit in helping skin quality in the eyelid area, in the face, for acne scars, for wrinkles. So we've been very much focused on the concept of regenerative medicine and the use of platelet-rich plasma in that way. Sometimes we combine this with thermal treatment. We do it very conservatively. It is my opinion that a lot of people are getting overheated. There is an overwhelming number of devices that are claiming better tightening with a lot of thermal energy. From my experience, I find that excess thermal energy has resulted in a lot of people's skin getting very thin. That being said, a technology such that we use called fractional CO2 laser has been very advantageous for a lot of our patients because there is a certain resurfacing component to that, where the top layer of skin is freshened up. Now, looking at volume in the tear trough or under eye hollow area, we have found that, yes, fillers such as Restylane or something in the hyaluronic acid family can be very effective. We have also seen a synergy in the combination of hyaluronic acid with platelet-rich plasma, and we've also seen a pretty good longevity with that. Now, unfortunately, there is some variation. Just like everybody can exercise and everyone develops muscle differently, the response to the hyaluronic acid and the platelet-rich plasma has to be observed to determine the frequency in which repeat treatments are necessary. Unfortunately, there isn't a perfect solution that is a single surgical, one-time, get it done and then it's over type of situation when you're talking about volume loss. There is a strategy and there is a lot of finesse, artistry, and clinical observation necessary. So at this point, I hope you have learned a little bit about your options, but I think it's best that you meet with some qualified, experienced doctors who are very familiar and comfortable in this area and feel this is basically something that is going to require some maintenance. I would not recommend fat transfer directly into this thin eyelid skin area. I have had patients come to me from all over the world requesting excision and removal of fat that did not turn out well. That is unfortunately the reality with a lot of situations with fat transfer because the fat and the fatty tissue can heal in an irregular way and the skin is not very forgiving. So I think that also think about the eyelid to cheek junction. This is an area which is a continuum, and when you think about the relative hollowing under the eye, you can also think of the volume loss in the cheek area. For men, it's typically not as much of an issue as it is for women, but it's something to be mindful of in terms of the overall strategy of having your eyes look better and therefore your face looking better. So I hope that was helpful. I wish you the best of luck, and thank you for your question.